And now from here, with your strap in your right hand, let's let that foot come down to the right.
Lara Fieria was diagnosed with rheumatoid arthritis 25 years ago.
It came on for me when I had another illness. I had a high fever, and I all of a sudden started noticing joints in my hands were hurting. So my fingers would hurt, they'd be stiff and hard to move. But the fever and the other illness went away, but the soreness never did, and it eventually moved to the rest of my body.
That was when she was 17, and with a newly diagnosed autoimmune disease that causes severe joint pain, Lara was worried her active lifestyle might come to an end.
When I was in my 20s in college, was the worst of it. I would have days where I couldn't walk for a couple of days.
But now at 42, she has discovered the benefits of yoga, and she even has become an instructor. It has helped her not only to relieve her pain and strengthen her body, but to relax as well.
I knew that the pain was coming, and I would tense everything up, and they've found in working with people who have chronic pain that it's pain on top of pain. There's a certain level of base pain, but then the tensing and the fear about the pain adds even more. And so by relaxing and by training the body to relax, it definitely reduces the sensations of pain.
People with rheumatoid arthritis mainly have joint pain and limited mobility. It tends to affect the hands and the feet most commonly, but can occur in any joint. They can also note redness and swelling, and what's prominent is a morning stiffness. So people wake up and have a very hard time getting moving. That stiffness may last for hours, even the whole day, and that stiffness includes a lot of pain.
So doctors say along with drug therapy, exercise is crucial. It keeps the body limber and the muscles around the joints strong. It also helps patients maintain bone strength, control weight, sleep better, and have an overall sense of well-being.
While you're having active disease, or before your disease is well controlled, you clearly don't want to do a lot of high impact activity. What you want to do is low impact activity. That's walking, biking, swimming. Those kinds of activities really give you a chance to put your joints through a good range of motion and keep those muscles strong to support those joints.
That is why Lara turned to yoga.
In gently moving the body around, it lubricates the joints, it strengthens the muscles that support the joints so that they stay in a more open position, and just the act of movement is helpful.
They're very complicated positions, so you want to be sure you're checking with a good yoga instructor who understands arthritis and can give you the appropriate positions and ways to exercise using yoga. But it is a great way to think about getting that good range of motion, relaxation, and relaxing your mind.
It really, really does help to keep moving. It's good for your body, it's good for your joints, it's good for your spirit. It makes you happier. So.
Holly Fur for CNN, Atlanta.
Hi, I'm Sylvie Ferrero, and we're here at Billy Beck III Personal Training Center in Weston, Florida. And today we're going to show you how to exercise with rheumatoid arthritis. Now, if you have arthritis, you're going to not want to move. It hurts, it's painful. The tendency is to not want to actually move. But exercise is so important, guys. I can't stress it enough. It's going to help build strength in your joints. And if you don't exercise, you're going to lose flexibility, mobility in your joints. And also, the joints become disfigurated. So you want to exercise. What you want to focus on is low impact cardio, things like pool exercises. Tai Chi is fantastic. And you can also do resistance training, of course. One of my favorite resistance training type of exercises is isometrics. So rather than pushing and pulling weights, which is weight bearing and it actually adds pressure to the joint, we're going to do isometrics. So we're going to relieve some of that pressure. This is Lauren Huff, and she's one of our super trainers here at BB3. She's going to help demonstrate our two exercises for you. The first one, you can use any door. We're going to use the men's bathroom door, or you can use the wall, whatever works for you. You're going to be standing a little bit further away from the wall than your arm's length, and you're slowly going to bring your chest towards your hands. Now notice her abs are nice and tight, her shoulder blades are tight, and she's got her shoulders down away from her ears. She's holding this position 90 degrees at the elbows. If it's too much for you, you can come up a little bit more away from the wall. And basically, you're going to flatten out and spread out your fingers. That's going to help increase some flexibility there. So she's pressing evenly through the fingers. Okay, and you're going to hold that anywhere from 10 to 15 seconds, increase to 30, and then eventually 45 to 60 seconds as you get better at this. Come on up, girl. Breaking a sweat, right? I mean, it doesn't look hard, but it actually gets hard, even for this girl with all these muscles. Okay, so the next exercise, we're going to do a really simple one. We're going to increase the flexibility and strength in your joints of the hand. A lot of people suffer from that, so it's hard to pick up weights. We're going to strengthen them by extending the fingers as much as you can. See, her fingers are actually turning upwards a little bit. She's working the muscles on this part of her hand, and now she's going to make a fist. And it doesn't have to be a crazy tight fist. Go ahead and she's going to drop her knuckles. But a little bit of pressure, and as you get stronger, you can go ahead and increase the intensity of the fist. Not to the point where you're shaking, but definitely where you're feeling a little bit of tension. Lower the thing, and then you're going to open and close. And again, you'll start with anywhere from 5 to 8 reps and increase to 10 and eventually about 20 reps as you get better at this. Hope this helps you out, guys. I hope you feel better. Get out there and exercise. You're going to feel so much better, and I promise you will not regret it. This is Sylvia Ferrero, and this has been Lauren, and thanks for watching. This has been How to Exercise with Rheumatoid Arthritis.